Northeast Regional Children's Advocacy Center is pleased to present this video training to talk about the importance of the medical exam in child sexual abuse cases and to talk about the importance of a medical provider that has specialized training in this area. We work with many multidisciplinary team members from law enforcement, child protection, prosecution, victim advocacy, mental health, and medical. And we often see a turnover and have new people coming to the table for child abuse cases. So it's important for them to have this information to share about the medical exam so that they can, in turn, share with their peers and families and kids about what a medical exam looks like.
So the medical exam is important in child sexual abuse cases for a variety of reasons. First and foremost is the ability for the medical exam to ensure the general health and well-being of the child.
The other thing is, and we don't like to think about this, but sometimes during an interview, kids don't tell us everything that's happened to them. So that, we may not be expecting to find any injuries based on what this child has disclosed and that we know of so far, but we might actually find something, so we don't want to miss those cases. So a lot of caregivers often are hesitant to have their child go through the exam. And I think most of the time it has to do with their own misconceptions about what's going to happen during the exam, so I really try to spend a lot of time getting at those misconceptions and what they think might happen and answering any of the questions that they have so that they can be present and supportive to their child during this process.
Particularly explaining to them about the exam, that it's going to be a head-to-toe examination, just like they complete at their regular pediatrician's office, but will include a detailed genital and anal examination as well. It's important to explain to families that it's not an invasive exam. It doesn't traumatize or hurt children, and we can explain every step of it to the patient and make sure that they have full control over doing the examination. We actually talk to parents so that they're prepared for this and are not expecting things such as a speculum examination, which is not done on prepubertal children.
During the exam, we typically do allow parents to be with their children. I personally think that kids do a lot better when their parents are present. And I think parents do a lot better too, because if they're not there, they imagine that this exam is some horribly scary thing. But if they're present and they see that their child is comfortable and happy and not crying, things tend to go much better.
Believe it or not, it's actually infrequent that we find abnormal exams. And only in 5 to 10% will an examination show an abnormality. So it's important to do the examinations to identify when we do have abnormalities, because some of them are very specific and can make the diagnosis of sexual abuse. In the majority of cases, so 90 to 95% of cases, we're going to have a normal exam. And it's very important for everyone to understand that a normal exam does not mean that nothing happened.
One of the reasons there may be no findings despite the disclosure of abuse is that children can be abused in many different ways. So young children, the method of abuse may be fondling or licking, and those types of activities I wouldn't expect to leave a mark. Additionally, the tissue in the genital area is really quite resilient and it heals very quickly. So even if there was an injury at the time of the event, oftentimes by the time the child gets to medical care, then that finding, if there was one, could have easily have healed. And again, that just speaks to the robustness and the ability of the body to heal quickly. Another reason that the exam could be normal is that not uncommonly there can be a lag between when the exam occurs from when the actual abuse incident occurred. And in that gap, or in that delay in seeking care, or delay in the child's ability to fully share with a trusted adult what may have happened to him or her, the tissue could have already have healed.
If we're talking about sexual abuse concerns that have come up over the last contact was within 24, 72, or maybe even 120 hours, those kids absolutely need to go to the emergency room. In most emergency rooms in Maine, we have sexual assault nurses who are trained to collect evidence around the clock and can get that taken care of for us, so you don't have to wait for our clinic to open the next morning.
Forensic evidence collection is completed for children, adolescents, and adults when there is a history that identifies the potential for transmission or exchange of bodily fluids. We actually have different time frames, so we will do forensic evidence collection for children when they have disclosed sexual abuse that has occurred within 72 hours. And for adolescents and adults, that same examination with forensic evidence collection will occur up to 120 hours after the incident.
Similar time frames exist when thinking about the need for emergency contraception in adolescents, as well as consideration for providing post-exposure prophylaxis for sexually transmitted infections, including HIV.
But really, all children, if there's any concern for sexual abuse, should have an exam even if they present after the 72 hours. And the reason is to make sure for the health and well-being of every child, we can actually complete an examination and really help answer questions that victims have about their bodies and really reassure them oftentimes that their bodies are normal and that they're okay despite the horrible things that have happened to them.
Then a non-urgent exam would be the child that is outside of the window of evidence collection. So outside of that 72 hours if they're prepubertal, or outside of that 120 hours if they're an adolescent. The exam should still occur, but again, there's just not that same sensitivity to timing of when it should occur. So that is to say that children presenting after the time frame that we've talked about don't need to come to the emergency department, for example. In fact, it's best and most prudent, quite frankly, if these children are scheduled for an appointment with a specialist, whether that's with a pediatric sexual assault nurse examiner at the Child Advocacy Center, or with a child abuse pediatrician if one is available in the area.
So I think many people are aware that if a child has disclosed sexual abuse that has occurred within 72 hours, that they may complete an examination with forensic evidence collection. But what other people don't always know is it's just as important for children who present after the 72 hours and therefore may not require forensic evidence collection, but does require a comprehensive, trauma-informed supportive examination so we can identify whether or not there may be injuries, when there's no injuries to explain why there's no injuries, and most importantly to explain to the victim themselves that their body is healthy and okay despite these things happening to them.
According to National Children's Alliance Standards for Accreditation, medical providers should have specialized training in order to provide these exams for child sexual abuse victims. And that includes whether it's a board-certified child abuse pediatrician or an advanced practice medical provider, such as a physician, nurse practitioner, physician's assistant, someone that has at least 16 hours of didactic training in the evaluation of medical exams for child abuse victims, or a registered nurse that may have gone through the SANE program, the Sexual Assault Nurse Examiner program, or the Pediatric SANE program. So those would be the providers with specialized background that we want to refer kids to throughout the country. The Children's Advocacy Center model is a multidisciplinary team response to child abuse investigations, prosecution, and the many services that kids and families need in the aftermath of a disclosure. It's a coordinated response to help minimize the trauma to kids as far as the number of times they need to be interviewed. It is a coordinated response for services so that kids and families get connected to specialized services for medical, mental health, victim advocacy, and other pieces, and to really ensure that the family is on the path to healing.
So between the 3 medical providers at SPURWINK, we do work with all of the children's advocacy centers in Maine, and we try to attend all of the monthly case review sessions as much as we can. And basically we're there to provide updates on any exams that we've conducted. We're also there if the team has questions, and we can provide some consultation on maybe why a child should have had an exam and maybe why didn't they have an exam. And we can also help interpret sometimes if there are findings of sexually transmitted infections, or if an emergency emergency room has offered an opinion about a particular medical issue, we can sometimes help clarify that for the team and explain that as well.
CACs work with medical providers in a variety of ways. There are some children's advocacy centers that have on-site medical care, such as Philadelphia Children's Alliance, that has board-certified pediatricians that see patients at the CAC. Other states like Massachusetts utilize a PD SANE model, where the pediatric sexual assault nurse examiner is located on-site at CACs across the state. But many CACs use a linkage agreement with medical providers in their community to refer kids and families to those specialists, whether it's at a hospital or local provider.
I work with the PD SANEs when they have cases of sexual assault or abuse and consult around medical complexities that might arise. One of the key things that I would just like to impart as closing is that multidisciplinary team members should familiarize themselves with the various time frames and that limited window of opportunity for obtaining evidence collection from a prepubertal child and a pubertal child. Additionally, I think it is critical that they recognize the importance of getting a medical evaluation regardless of when the child is disclosing that the event occurred.
So I think sometimes people underestimate the medical exam and how powerful it can be for families. Maybe we're not going to have an opportunity to collect evidence, maybe we're not going to find an injury, but just to be able to reassure that child and that family that their body is healthy and well and that there's nothing physically wrong with them, I think is very powerful, and we need to give that opportunity to every child.
This work is important to me because there are many parts of pediatrics that are clearly important. But I think what stands out about this particular work is its ability to give the child a voice in the context of something bad that has happened to him or her, and something that just really shouldn't have happened.
I have the opportunity to work with so many professionals in different disciplines, and it really is very rewarding to be able to work with professionals about a case and have a positive outcome for the safety and well-being, sometimes not only for that child, but other children that are in the same environment.
So often in medicine, bad things happen to children, but they have no control over it. But I think with regards to child sexual abuse, that is something that I think we can clearly agree that it shouldn't happen to any child, and being able to participate in a process that helps support the child and give the child a voice, I think is just very meaningful.
So lastly, we wanted to say thank you for watching this video and for your work in the field of child abuse and being part of a multidisciplinary team working with the Children's Advocacy Center. So thank you.